Good afternoon, Nutrition. How are you doing today?
Good, thank you.
All right, so last few times we've met, we went over some food items that were rich in carbohydrates that you'd want to take out of your diet. And then the next time we went over some substitutes for replacing those really rich carbohydrate foods for something that is more adherent to a diabetic diet. So there is a method that you can start utilizing that I want you and I to practice today called the diabetes plate method. And this is going to be what you can utilize as an outpatient in order to stick to a diabetic meal plan. All right. So on your laptop over here that I provided for you, there's a website called www.diabetesfoodhub.org. All right. And on that website, it's going to describe to you the diabetes plate method that I am going to demonstrate to you right now. All right. So first thing you want to have is a medium-sized plate. Research shows that plates have been gradually increasing in size in the United States, and we have a tendency to want to fill our plates, right? So if we select a plate size that's not too large, we're more likely to get the right portion sizes, all right? So the measurement across your plate needs to be about 9 inches, right? Doesn't need to be exactly, so if you're a little bit over, like this one's like 9.5, that's okay, right? But you want a medium-sized plate. And then you're going to break that plate into 3 sections. So half of your plate is going to be non-starchy vegetables. So these are things like asparagus, spinach, right? Very low in sugar. Then on the other half of your plate, you're going to have 25% a lean protein, some like turkey, right? You can have lean pork, that's okay. Fish, tofu products, lots of options you're going to have here. And then your final section is going to be your carbohydrates, right? So these are going to be like non-added sugars, like sweet potatoes, fresh fruit, dairy, all excellent choices there. Final step 4, is to select a beverage. Now the best thing for glycemic index would be just to drink water, right? But we all get tired of water, so if you want to substitute water with unsweetened tea, unsweetened coffee, you could even choose some of these zero sugar sodas, like Zevia is a good option that's become very popular, that just don't add any more sugar to your plate. All right. So can you go ahead and tell me each of the sections? Like if I just shield this plate here, could you tell me how you're going to break it up?
Half the plate should be a non-starchy vegetable.
Mm-hmm.
You said like asparagus or something like that. The other half should be broken into a quarter of a protein, like a lean protein, and then the other quarter should be a carbohydrate, like you said, squash or something healthy.
Excellent. All right. And what would you have to drink?
Water or something with no sugar.
All right. Perfect. All right. So a lot of times we go to the grocery store and we make impulse purchases, right? That may, if we're rushed or something, it may not fit to the diabetic plan that we want to have here. But what you'll find is if you kind of plan before you go to the grocery store with a shopping list, using the diabetes plate method, you're more likely to make the selections that are required to follow the diet plan. All right. So what I have for you here is a sample shopping list, right? And you can actually look at these shopping lists right here. I'll pull it up for you, and you can pull it up on your computer too. So at grocerylist.org, there's a whole bunch of these samples, all right? And what I want you to do here is to use the diabetes plate method on that shopping list to make 4 selections that follow the diabetes plate method. All right, so I'm going to give you like a few seconds here to kind of walk me through what you're going to do as far as your selections go. What meal of the day would you want to plan for?
Well, my favorite meal is always breakfast. Excellent. But I have a question.
Sure.
Does every plate have to just be broken up like this, or can I make something that just has all of those things in it? Like for breakfast, I usually like to have an omelet. Is that okay?
That's an excellent question. Most of the time, we're going to have some sort of combination food. I'll give you an example, like a salad, right? And that's perfectly okay. And it actually fits with the diabetes plate method just as long as your proportions in that combination food still adhere to that line of being half non-starchy vegetable, a quarter protein, and a quarter carbohydrate.
So it'd be an omelet with lots of vegetables.
Right, absolutely. So we want to have lots of veggies in this omelet, so primarily a veggie omelet, right?
Okay.
So what selection are you going to make? You just kind of walk me through step by step. So step one, what do you want to do here?
All right, so step one, I want to make sure to get lots and lots of vegetables. So some spinach, some tomatoes, some mushrooms, maybe some peppers. Those are all on the list here. I can buy that and use that. Step two would be the protein. So here it would be eggs for the omelet, maybe some turkey or turkey bacon. Is that okay?
Yeah, as long as it's lean pork, it's perfectly fine.
Okay, and then a carbohydrate on the side. It says on the list I can have cottage cheese, maybe some fruit.
Yeah, some fresh fruit, dairy, pork here.
Okay, and then a glass of water.
All right, glass of water.
And for breakfast, maybe a cup of coffee.
Right, yeah, a cup of what type of coffee?
Black, unsweetened.
Right, unsweetened coffee, right, and then we're good.
No sugar
all right?
for me.
So when I meet you next time, just like we did for breakfast, what I want you to do is to try using the grocery list to plan out your lunch and dinner. Right?
Okay.
And another option that you can utilize, I'll pull that website up for you here, and you can take a look at it as well. If you go to cdc.gov, you can pull up their diabetes weekly meal planners.
Oh, okay.
And this way, yep, I have one right here printed for you. That's true. Right, this way you can kind of reverse engineer what you're going to buy at the grocery store. And what I mean by that is that you can kind of choose what you're going to have for each meal of the day, like an overall, like let's say a combo food like a salad. And then you can go to your shopping list and select the items that you want in that salad and make sure that you're still following the diabetes plate method.
Buying the things that you should be eating.
Exactly correct, right? So if you want to practice utilizing that weekly planner and then going to the grocery list, or if you just feel like the grocery list is what you want to practice with for lunch and dinner, next session that we meet for nutrition, I want to see what options you made and see if we can do that for maybe a whole week so that when you're an outpatient, you can stick to the diabetes plate method, right? Do you completely understand the diabetes plate method? Do you have any questions?
I think so. What about alcohol?
Right. So, all right, alcohol is going to be one of those things that's rich in carbs, right? So maybe perhaps a low carb alcohol, as long as that is not going to interfere with any of the medications you're taking. That's something you can ask your physician. But I would definitely stick with no like sugar additives and those mixed drinks, everything. Just keep it as a low calorie, low sugar alcoholic beverage as possible. All right.
Thank you.
Okay. All right. Thank you so much. All right. I'll see you next time in a few days. Thanks. Hello, this is Arthur for the self-reflection portion of the patient education video. So I'm going to just go through each question and address them for what I thought was correct in each part and what needs a little bit of work. All right. So the first question are what are the wins? I thought the presentation was well organized. I kind of came up with a script for what I wanted to accomplish in the presentation, what the objective would be. Like, for example, my overall objective was for the patient to select items from a grocery list that satisfy the 4 categories of the diabetes plate method, which was able to be accomplished in the video. So I did get that correct. I also have that I wanted to select the appropriate tools as a win for the video. So one thing I wanted to show is that, I'm going to have a ruler to measure out the size of the plate because the size of the plate can have a huge impact on the diabetes plate method if your proportions are out of the whack. The other thing I really liked was kind of setting up the plate to show the patient what it looks like as far as, half my plate's going to be vegetables, quarter of it's going to be protein, quarter of it's going to be carbohydrates. So I really liked using that as a prop in the patient education. I also liked the utilization of a laptop and having the patient pull up the sites that I'm utilizing to teach them so that the likelihood of that patient as an outpatient going back to those websites to follow the diabetes plate method or to use a grocery list or a weekly meal planner would probably be increased if they're actually showing me that they can access it on a laptop while we're at the hospital. So I thought those were always all good wins. And it was just thorough, right? So we went through the diabetes plate method, had the patient teach back, and then have the patient practice. As far as what I've done right, I did provide the opportunity for the patient to practice a lot, even outside of the education session. So when they come back, they should be able to, demonstrate what they were going to do for lunch and dinner since we were able to do breakfast together. I did like encompassing the pedagogy of the teach back method. So I went over the instruction briefly as far as what the diabetes plate method is, and then I had the patient teach it back to me so I could check for comprehension. I also provided appropriate real-world resources like using a shopping list, because a lot of times I think that patients will make like an impulse buy at the grocery store that may not adhere to their diet. So if they're using that grocery list, higher chance they stick to that diabetes plate method. And I also had a healthcare outcome that was measurable, attainable, timely, and specific. So I knew that they had to select those four parts of the diabetes plate method, and they had to adhere to what each category was. That's attainable, timely, within the teaching session, and it was specific, right? What worked well? I thought the pedagogy involved in synthesizing that behavioral outcome in a teaching plan were strong. I liked the idea of having the patient demonstrate the diabetes plate method back to me using that shopping list, because that's kind of like real world what you would have to do in order to follow that method. My oratory skills, public speaking skills, clear in my instructions, clear with the patient. There was one section of the video where there was like an ad lib, like I didn't know that the patient was going to ask me about alcohol, but immediately, just like in a real world setting, I was able to respond based on the diabetes plate method of making sure those carbs are staying low in their diet. I also thought it was a well-organized and prepared presentation. All right, mistakes. What can I learn from in my mistakes? I thought a key mistake here was maybe trying to add too much. Like the weekly planner may have been a bit overwhelming for the patient, based on having to know the diabetes plate method and using the shopping list, and maybe having a little bit of like homework practice of the diabetes plate method, and that meal planner may be kind of just pushing too much at once. So I thought maybe here I could chunk that planner out, and just focus on the diabetes plate method with the shopping list, and then add the weekly planner on a separate session with the patient to see if they really do comprehend that diabetes plate method, and prevent them from becoming overwhelmed with the amount of information. All right, that's all the questions. Thanks so much.